Therapeutic massage. The content for this lecture can be located within Chapter 17 in the Therapeutic Modalities text by Chad Starkey and Chapter 18 in the Therapeutic Modalities, the Art and Science text by Kenneth Knight and David Draper. Massage is one of the oldest forms of healing techniques. Using therapeutic touch, the body's tissues are manipulated to reduce muscle spasm, promote relaxation, improve blood flow, and increase venous drainage. Even though massage is one of the oldest techniques that therapists utilize, it is still frequently used in modern medicine. There are many techniques and strokes that can be utilized in massage therapy. This chapter will explore the strokes and techniques that are most frequently used for therapeutic rehabilitation purposes. Unfortunately, due to perception, sometimes performing a massage does not always look right to someone who passes by or walks past a room. Therapists are often required to massage different body parts, either on a same gender or opposite gender person. Remember, as an athletic trainer, physical therapist, occupational therapist, or other healthcare professional, you are not a massage therapist. A massage therapist's sole job is to perform massages for a financial gain, but the type of setting in which these massages are performed, for example, private rooms for each patient, is not always available in the therapy setting. Therefore, it is essential that every clinician adhere to the highest ethical standards possible when performing massages in a therapeutic setting. There is the potential for actions during a massage to be misconstrued either by the patient you are working on or by others around the patient. Remember, perception is whatever other people think, believe, understand, or interpret a situation to be. One person's perception may be different than another's and may even be different from reality. But unfortunately, people's perception is their truth and what they believe is going on in a situation. You as a clinician need to make sure that you are protecting yourself and the situation from being incorrectly perceived or perceived differently from what you intend. People's culture, religion, background, experiences, and expectations all play into their perception. So it is important to be aware of your surroundings, and every situation needs to be treated a little bit differently. For example, if there was a male patient and a female therapist, or even vice versa, a female patient and a male therapist. Now let's place this scenario in a private room. Does that change your perception? Maybe, or maybe not. Some people would be fine with this, but others may definitely think that there is something wrong with this picture or may perceive it as being inappropriate. Even though the intent of the massage is a professional one, I would highly encourage you to think about the perception that massaging someone in a private room sends. This is my recommendation, that it is better to be safe than sorry. If you are going to perform a massage in a private room, you should have a therapist with you who is the same gender as the patient. In order to work with the highest standards of professionalism, I would encourage you to consider these issues when performing a therapeutic massage. Avoid unnecessary touching and/or overexposing the patient. Consider your own personal hygiene and cleanliness. During a massage, you are in very close contact with people, so if body odor is an issue or there is gunk underneath your fingernails, your patient may not feel very comfortable with the treatment, and patient comfort is very important during this type of treatment. Drape, drape, drape. Please make sure that you cover your patient appropriately. You should only need to expose the area that you need to work on, but I would highly encourage you to have extra towels, sheets, or blankets in which to drape over other areas not being treated. Draping helps keep your patient warmer, which increases their comfort and relaxation, but it also protects their privacy. Use a spotter if needed. This person can help you place the patient in a correct position or may just be there as a witness to the therapeutic treatment. There are few things harder to defend in a legal court than a he said, she said type of argument. Go into the massage with confidence. The more confident that you are, the more your patient can relax and get the full benefit out of the treatment. Get verbal consent prior to beginning the massage. Please realize that in some cultures, religions, and even just some personal preferences are against personal touching. If your patient says no, then massage is not the right treatment for them, and we will have to come up with other alternatives. Please remember to remove watches, rings, and to trim your long or jagged fingernails. Since you are utilizing your hands most frequently to perform a massage, anything that could scratch or be uncomfortable to the patient should always be removed prior to starting the massage. Another major issue would be to avoid any awkwardness while you're performing the massage. Sometimes bodily functions, such as passing gas, having the massage lotion or oil make an awkward noise, or having body parts shift across the table or stick to the table, or slipping off a knot while you're performing a massage. As a clinician, it is best to just let it go and not say anything and move on. Eventually it happens to all of us, and it isn't a secret that we all perform those body functions. It really isn't a big deal, and it's not a good idea to laugh or make comments about your patient who may or may not be embarrassed by the situation. Also, be careful of what you talk about during the massage. It's better to have some idle chatter, talk about the weather, sports, news, etc., rather than to talk about personal issues. I would also encourage you not to talk about other patients. Also, be careful of making comments about people's anatomy or the way they look. Many people are very self-conscious during massages, and any comments could make the situation become very awkward. In order to perform a quality massage, it is imperative that you have a solid knowledge of anatomy. You need to understand when you are rubbing in an area or a patient has soreness, what tissues could be affected. Is the pain or soreness coming from a muscle, tendon, fascia, or something else? What layer of muscle are you dealing with? It is important to study, touch, and feel of your patients. Usually this comes from hours and hours of practice. The more people you can perform massage on, the easier it is to become comfortable and knowledgeable in the way that things are supposed to feel and what is considered unusual or a different presentation. I would highly encourage you all to pay attention in your anatomy classes. While I understand that learning muscle origin, insertion, action, innervation, and palpations can seem tedious, this knowledge is very important to clinicians, both with therapeutic interventions and also with rehabilitation protocols. Depending on the stroke of the massage, it may require the use of a lubricant to increase the comfort for the patient. There are many different types of lubricants, including powders, creams, and oils. The amount of lubrication needed depends on the technique that is used and also the strokes that will be utilized during the treatment. One of the most important things to consider when performing the massage is both the patient and the clinician comfort. You will have to decide whether you want your patients to lay supine, prone, side-lying, or even sitting upright for the massage. Making sure that your patient can breathe and relax and is comfortable during the entire massage is very important to the treatment. Also, making your patient move as little as possible during the treatment helps with the overall relaxation. These are many examples of different tools that can prop, support, or allow your patient to be massaged in comfort. The prone pillow allows the patient to lie prone with the head straight. There are ventilation channels that allow for fresh air to get to the patient's face during the massage. In some instances, a prone table can be used that has a prone pillow as an attachment. You may also want the patient to be seated, and therefore there are massage chairs available. In addition, the use of movable wedges or bolsters can help make your patient more comfortable during the massage. Certain conditions may require that a patient not lay on their back, such as pregnancy and severe obesity, among other conditions. Therefore, having your patient side-lying may be an option as well. In addition to patient comfort, as a clinician, you may be performing massage for a while. Therefore, it is vital that you use good posture as well. Whenever possible, use large muscle groups, which will allow you to use your body weight to perform massages and can allow you to support yourself well during a massage. I would encourage the use of an adjustable height table as well when possible. If an adjustable table is not possible, invest in a stool that will allow you to adjust your own personal height to the table so that you can work at the best angle possible. I would highly encourage you not to lean over the table as your low back will not appreciate it, and typically the massage will be cut short as your body cannot stay in this position long before starting to hurt. Again, pick the right height table so that you can use your body to work efficiently. If you cannot adjust the table, then adjust yourself. Get a stool, maybe kneel on the table, but you need to make sure as a clinician that you are not injuring yourself while you're trying to treat others. Massage can be very tiring on the hands. Depending on the strokes, you can utilize different parts of the hands so you don't get so tired. The most common parts of the hand utilized for massage therapy are the entire palmar surface, the hypothenar eminence, which is opposite from the thumb, the thenar eminence, which is the fleshy part of the hand on the thumb side, the heel of the hand, the fingertips, the finger pads, the knuckle, fist, elbow, and the list goes on and on. You can be creative. If you are going to use massage tools, make sure they are the right ones. They should not be wooden kitchen spoons. For a little laugh, check on Blackboard. There is a clip from a Friends episode in which the wrong tools are being utilized for massage. While I realize Friends is an older show, this clip still is pretty funny and has some practical applications to this lecture. Also, please make sure that your pressure and touch is a friendly one. Just because you like more pressure does not mean that all of your patients do. Be sure to communicate with your patients to make sure they are comfortable during the treatment. In addition, some of you have very bony fingers. Be aware of that during the massage. There's a quick little video on Blackboard, again from Friends, that covers this issue. Massage techniques are utilized for many different purposes. Some of the most common uses for massage include painful conditions of musculoskeletal origin, muscle strains, muscle spasm, myofascial adhesions, and trigger points. Fascia is a band or sheet of connective tissue, primarily collagen, that is beneath the skin that attaches, stabilizes, encloses, and separates muscles and other internal organs. Fascia is classified by layers as superficial fascia, deep fascia, and visceral fascia, or by its function and anatomical location. Fascia are similar to ligaments and tendons as they have collagen as their major component. They differ in their location and their function. Ligaments join bone to another bone, tendons join muscle to bone, and fascia surrounds muscles or other structures. Fascia is made up of fibrous connective tissue containing closely packed bundles of collagen fibers that are oriented in a wavy pattern parallel to the direction of pull. Fascia is consequently flexible and is able to resist great unidirectional tension forces until the wavy pattern of fibers has been straightened out by the pulling force. These collagen fibers are produced by the fibroblasts that are located within the fascia. Fascia is located pretty much everywhere in the entire body and has a spider web-like appearance. The physiological effects associated with massage include vasodilation, or an increase in blood flow. During massage, histamine is released, which causes an increase in body and tissue temperature. There is an increased venous and lymphatic return, and also a sedation or decreased activity of the nerve endings, which could reduce pain perception. In addition, there is an elongation of the muscle, fascia, and capsule, which may help to decrease the effects of delayed onset muscle soreness, or DOMS. Depending on the type of massage, relaxation, decreased heart rate, decreased respiration rate, and a decrease in blood pressure are also seen. For many people, massage creates a general feeling of well-being. Never underestimate the power of a healing touch. Humans are not the only ones who participate in massage to feel good. Cats will massage each other too. See? Cat massages, they really do exist. Massage affects tissue through four primary effects: a biomechanical, physiological, neurological, and psychological effect. The biomechanical effect of massage comes from the mechanical pressure on the tissues. This results in decreased tissue adhesion, increased muscle compliance, increased joint range of motion, decreased passive stiffness, and a decreased active stiffness of the muscle. The physiological effect of massage comes from the change in the tissue or the organ. This results in an increase in muscle blood flow, increased skin blood circulation, increased parasympathetic activity, increased relaxation hormones, and decreased stress hormones being released. The neurological effect of massage comes from the reflex stimulation. This results in a decrease in neuromuscular excitability, decreased pain, and a decreased muscle tension or spasm. The psychological effect of massage comes from the increased relationship between body and mind. This results in an increased relaxation and a decrease in overall anxiety. The indications, precautions, and contraindications can be located on page 352 within the Starkey text. The primary indications for the use of massage include edema reduction, muscle spasm, scar tissue, myofascial adhesions, decreased range of motion, and increased muscle tone. The precautions for the use of massage includes impaired sensation. We may have to apply decreased pressure, and hypertension. The contraindications for the use of massage include acute injuries and areas of active inflammation. We may actually increase the inflammation if we apply massage too early, over skin lesions or dermatological diseases, vascular disease including blood clots, infections, unhealed fractures, and people who are hypersensitive to touch. There are multiple strokes that are associated with massage. For the sake of this lecture, we will focus on the most common ones, which include effleurage, pétrissage, friction, tapotement, vibration, and myofascial release. We'll start with effleurage. Effleurage is a stroking of the skin. We typically use effleurage to warm the patients up to our touch and to gauge areas of tightness within the patient. All effleurage strokes are performed in a rhythmic manner. Strokes should be directed towards the heart. The thumbs can be used to fit into anatomical contours such as between the toes or behind the malleoli. Ideally, at least one hand should be in contact with the patient at all times. Superficial stroking stimulates the tissues and encourages blood flow if done fast. Slow superficial stroking promotes relaxation in the patient. Deep stroking stimulates deeper tissues and forces fluid in the direction of the stroke. We typically use effleurage at the beginning and the end of massage. It can also be used between pétrissage strokes to make the patient more comfortable. At the beginning of the massage, we are introducing our hands to the patient. This stroke helps to relax the patient and to scan the area for areas of tightness. At the end of the massage, we use effleurage to calm down irritated nerves. Here are some examples of effleurage. Please also watch the YouTube videos on Blackboard for more insight on the stroke. Pétrissage is similar to kneading dough. Pétrissage is the lifting, kneading, and rolling of the skin, subcutaneous tissue, and the muscle with the fingers or the hands. This stroke is similar to myofascial skin rolling, but pétrissage targets the underlying muscle and is particularly useful in the superficial, mobile muscles such as the upper trapezius and the forearm muscles. Pétrissage frees adhesions by stretching and separating muscle fibers, fascia, and scar tissue. This technique milks metabolic waste products, assists in the venous return, and can lead to muscular relaxation. Here are some examples of pétrissage. Please also watch the YouTube videos on Blackboard for more insight on this stroke. The tapotement stroke is a gentle tapping, rapping, or pounding on the skin. Tapotement promotes muscular and systemic relaxation. It also desensitizes irritated nerve endings. Tapotement is often used following vigorous techniques such as friction or pétrissage. Tapotement may also be used when you are trying to get the patient to relax and may be performed over clothing. Different forms of tapotement include cupping, in which the hands are cupped when striking the skin, hacking, in which the lateral side of the hands are used to strike the skin, and even pincing, which is where the skin is sort of gently pinched between the fingers. Another technique is slapping, in which the skin is gently slapped to form a percussion. Here are some examples of tapotement. Please also watch the YouTube video on Blackboard for more insight on the stroke. Friction massage mobilizes muscle fibers and separates adhesions in muscle, tendon fibers, or scar tissue that restricts motion and causes pain. It is used to facilitate local blood perfusion. There are two primary types of friction massage: circular and transverse, also known as cross-friction or cross-fiber massage. Circular friction massage occurs with the two thumbs moving over a small area in a circular motion. Circular friction massage is great for treating muscle spasms, trigger points, and scar tissue. Transverse or cross-fiber massage occurs when the thumbs or fingertips are moving in opposite directions. The treatment is typically performed perpendicular to the tissue being treated. Transverse massage is great for treating muscle spasms, trigger points, and motor points. This massage stroke is most often utilized for tendinitis. Here are some examples of friction massage. Also, please watch the YouTube video on Blackboard for more insight on this stroke. The vibration stroke is a rapid shaking of the tissues. The effect of vibration is to soothe peripheral nerves, promote relaxation, and increase blood flow. If an individual is skilled, vibration can be performed manually. If an individual is not skilled, vibration massage can be performed mechanically with a lot of different devices such as the thumper. Vibration could be utilized to invigorate an individual prior to going out to play, returning to work, performing rehabilitation, or sending a patient out of the clinic right after massage. With vibration, please be careful. Some individuals are not comfortable with having body parts jiggled. It could be anybody, but individuals who tend to have more body fat can sometimes be sensitive to having certain body parts jiggled. Genders can also play a factor in this as well. Your patient's comfort is the #1 priority, so please be sensitive to your patient's modesty and never embarrass your patient. Communication is the key to making sure you are working with your patient to determine the proper treatment. Different factors need to be considered prior to utilizing vibration. These include age of the patient, year in school if they're a school-aged child, gender or sex, location of the massage, and how the therapist presents themselves. This is also our professionalism. Myofascial release involves the combination of traditional effleurage, pétrissage, and friction massage with simultaneous stretching of the muscles and fascia to obtain relaxation of tense or adhered tissues and restore tissue mobility. Fascia forms an interconnected network that connects and surrounds muscles, tendons, nerves, and separates the skin and adipose tissue from the underlying muscle. Myofascial release attempts to restore normal function by breaking down adhesions and restoring normal fascial length. Fascia does not deform when it is exposed to quick, high-intensity forces. Fascia will, however, elongate when a slow, moderate-intensity force is applied to it, an effect referred to as creep. These myofascial techniques should be followed by traditional muscle stretching techniques. Specialized training in myofascial techniques is needed to become proficient in these procedures. The J-stroke is one of the most fundamental forms of myofascial release and is used to mobilize superficial fascial restrictions. Skin rolling also reduces superficial myofascial adhesions. Depending on the amount and the depth of pressure being applied, focused stretching can release both superficial and deep fascial restrictions. The arm pull, leg pull, and a diagonal release attempt to stretch large areas of fascia in the extremities and the torso. The flow of the massage is really up to the therapist and the patient. A common flow to follow would be to start easy, go deep, and then finish easy. We could start our strokes with effleurage. We could start these strokes by starting superficial and then working our way into deeper effleurage strokes. We could then progress into pétrissage, then progress to friction, then myofascial release. We could also perform vibration or tapotement between other techniques, and then we could end the treatment with effleurage again. But this is just one example of a flow for a massage therapy session. It's completely up to the clinician and the patient on what they feel comfortable with and what is actually needed to perform the treatment they need. This table is a summary of the basic massage strokes and their physiological effects. This table can be found within the Starkey text on page 340 in Table 17-2. Remember, your hands have a lot to say about your skills as a therapist. By using your hands to perform massage, you are communicating to the patient in a body-to-body communication. Your confidence and your thoughts are all then transmitted into your hands. You really need to be mentally and physically present when performing the massage, and this tends to take a lot of concentration. Practice makes perfect. Practice, practice, practice. The more you touch people, the better you will be. Another technique for massage is instrument-assisted soft tissue mobilization. It can be very hard on the hands to perform massages for long periods of time, and therefore, utilizing instruments with the massage techniques can be very helpful. These instrument-assisted mobilization techniques generally encourage realignment of scars and myofascial restrictions. There are multiple different types and styles of instrument-assisted mobilization. Some of the most common or popular techniques include guncha, sound-assisted soft tissue mobilization, augmented soft tissue mobilization, and Graston. There is also Factor, as well as many other systems in place. What makes these tools good? They can cause less strain on the therapist. They can also help to amplify the underlying unhealthy tissue texture. They are also more efficient, and therefore we can have shorter manual therapy sessions for our patients. Soreness and red petechia markings are common after the procedure, but should go away within 24 to 48 hours. We have to be careful though. We do not want to put too much pressure, and we do not want to bruise the patient. Remember that bruising may happen, but it is not the primary purpose of the treatment. Bruising typically indicates that we have damaged the tissue, so we would need to be extremely cautious in the following treatments. Please do not forget to take quiz number 13. It is over Chapter 17, Therapeutic Massage. You will have 10 minutes and the quiz will be worth 10 points.